Hello, everyone. Morning, afternoon, or evening, wherever you are. My name is Abel Ndasho. I will try to turn on my webcam if it is possible, just so that you can see me, and I'll just say hello. Yeah, I'm not sure if you can see me, but yeah. Great. I'm the IMANA Program Coordinator, and welcome to today's webinar co-hosted in collaboration with Ag2Nut. The focus of today's webinar will be on economic evaluation of agricultural nutrition programs. To help us understand more about how to assess cost effectiveness of agricultural programs for nutrition and answer all your questions on economic evaluations, we're delighted to have with us two guests today. Carol Levin from University of Washington, and also James Levinson from Tufts University. Carol is also the co-author of one of the ANH Academy technical working groups on economic evaluation. That's economic evaluations of multi-sectoral actions for health and nutrition. You can download this technical brief from the resource section of the events page on the ANH Academy website. I'm sure many of you know about the Agriculture, Nutrition and Health Academy, which is a global research network in agriculture and food systems for improved nutrition and health, which served as a platform for learning and sharing. We have members in over 90 countries, and if you've not signed up yet, then we encourage you to join the Academy Week. It's free. I will send the link on the chat box for you to register after the webinar. As well as convening technical working groups, hosting webinars and blogs, we also have an annual meeting of the Agriculture, Nutrition and Health community. This year in June, the 4th ANH Academy Week took place in Hyderabad, India. And again, we encourage you to look at the report of the Academy Week on our website. Next year, the 5th ANH Academy Week will be held in Lilongwe in Malawi. That's from 29th of June to 3rd of July. So please save the date. The call for abstracts for the research conference on the nexus between agriculture, food system, nutrition and health is now open, and the deadline to submit your abstract is in January 15, 2020. For more information on this and other ANH Academy activities, please visit our website. That's www.anh/academy.org. We also have other opportunities from the Innovative Methods and Metrics for Agriculture and Nutrition Actions. That's the IMANA program. The first one is round 5 of the IMANA Fellowship. The full application for round 5 of IMANA Fellowship for Emerging Leaders in Agriculture, Nutrition and Health Research is now open. The deadline for the full proposal is 1st of February 2020. The second opportunity that we have is the IMANA grants. That's round 3 of the IMANA grants, which is a competitive research grants to develop and validate innovative methods and metrics for agriculture and nutrition actions. The deadline to submit the concept memo is this Sunday. So that's Sunday, 15th of December. Before we get started, I'd like to go over a few technical items so we all know how to participate in today's event. And you will see the presentation on the left of your screen. On the right, you have the control panel that will allow you to ask questions. You will have the chance to submit text questions to today's presenters by typing your questions into the question box. You may send in your question at any time during the presentation. We will collect this and address them during the Q&A time. All participants are currently muted. If you want to ask a question using the audio function and you're sure your microphone and speakers are working, please use the raise your hand function during the Q&A, and we will unmute you. If at any point you experience any technical issue, please check your audio setting and your internet connection. If lost, please try to connect using the same link that you got from us. This webinar will be recorded and will be available on the ANH website. I think that's it for me for now. I will pass the mic to Anna.
There, no, I think I've unmuted. Hi, everyone. Thanks for joining this webinar. That's an Ag2Nut webinar co-hosted with ANH Academy. And thanks, Abel, for the introduction and for providing this platform for our community to meet. This is a really exciting topic that we have today because it's something that has come up a lot in ANH Academy Week when many people present about their programs and how they can be evaluated. And in general, you know, it's one of the perennial topics in agriculture and nutrition programs and interventions, which we all in this community care about. I'm especially excited today because Jim Levinson is here to be a discussant, and I took program monitoring and evaluation class from Jim as a student, as I think at least a couple others on this call probably did as well. One of the best classes ever. Hi, Jim. And I learned a lot of things in Jim's class about program M&E, a lot of things that complexities of monitoring and evaluating programs, especially when they are multi-sectoral. And that cost-benefit analysis and assessing cost effectiveness are really essential tools for evaluating a program. Basically, is it worth it to invest in programs like this, whatever program's being evaluated? That gets really tricky when we have ag nutrition programs where there are multiple outcomes and multiple benefits that can come from the intervention in different areas. So there could be a specific nutritional outcome that's desired or targeted through the activities of the program, as well as economic outcomes, as well as social outcomes, gender equity outcomes, sustainability and environmental outcomes. And then further down the line, expected benefits after the program ends in all of those areas. So how can we manage cost-benefit analysis, cost analysis in general of programs with such diverse impacts and potential benefits without selling ourselves short and only measuring certain items, whereas the potential impact may be broader and difficult to measure? So Carol Levin is here today to lead us through this discussion. She's been working on it a lot and has a lot of insights to share. So she is an agricultural and health economist. She's an associate professor in the Department of Global Health at University of Washington. And her research right now focuses on cost and cost effectiveness of introducing and scaling up public health interventions related to maternal and child nutrition and health. She was also the co-chair for the ANH Academy Working Group on Economic Evaluation of Agriculture, Food, and Livelihood Strategies for Health and Nutrition. I believe a brief was produced out of that work, and we can share the link for that. There was a learning lab on that in the Academy last year as well. She's currently directing the project Strengthening the Economic Evaluation of Multi-Sectoral Strategies for Nutrition, with a clever acronym, SEAMS Nutrition. And so she's really been focusing on this question quite a lot, and will share insights. And before I turn it over to Carol, we're just going to have the way the call will go is she'll give a presentation, then Jim will respond with some further thoughts, and then we'll have a discussion where I will call on those who have their hands raised in the discussion time. So Carol, over to you.
Thank you, Anna. Thanks very much. And I'm hoping that, thank you for acknowledging our clever acronym, SEAMS Nutrition, because the project title is a mouthful. So I'm happy to be here today, being able to talk about something that I'm passionate about and have been for many years. So looking forward to presenting quickly and then answering your questions. So today, what would be useful, I think, if we came out of this understanding what some of the data needs, challenges, and use cases of evidence on cost or cost effectiveness and cost benefit for agriculture nutrition investments. What do we know about this today on the cost and benefits of nutrition-sensitive interventions? And we'll focus today on agriculture nutrition specifically, recognizing that WASH and livelihood programs are also important, gender empowerment programs, but we're going to limit what we focus on today for our audience. And we'll go over sort of a new approach of standard economic evaluation methods, but tailored for nutrition-sensitive and multi-sectoral strategies to improve nutrition. So why don't we get started? And what I wanted to do is motivate the need for this. Anna's given a good introduction to the topic and the need for it. And really what we know works in helping to allocate resources in global health for the areas we work in our economic evaluation to support decision making. And you can see that in global health more generally, that this has been essential in areas like HIV/AIDS, cancers, infectious disease. You can see that we haven't been using this information as well to address malnutrition, both undernutrition and overnutrition. And what most of you are probably familiar with is a strong body of work for nutrition-specific interventions, and we'll go over that in a moment. So what kinds of information are we really talking about? Economic evaluations, there's a large categories of different types, but mostly what we're referring to when we say economic evaluation is either cost effectiveness analysis, and the measurement is typically in dollar terms for the cost measurement, and then looking at some sort of natural health outcome, maybe a case of stunting averted, a death averted, or a disease case averted. And this is our most typical cost per death averted, cost per infection averted. The next is cost utility analysis, where your costs are measured in dollars. And this is where most of you, I'm sure, have heard at one point or another that the cost per DALY averted is $150 perhaps. So this is where we compare net costs and benefits of a metric that combines both death and disability. Why? Because if we perhaps vaccinate a kid against rotavirus, we're preventing a severe form of diarrheal disease, but we're also preventing a death. And you can have a metric that combines both death and disability into a single measurement. And our third popular type of economic evaluation is a cost-benefit analysis or benefit-cost analysis, which compares the net costs and benefits, where we actually assign the numerator, the cost, and the denominator, the benefits, in dollar terms. And often this is used to get what we call a return on investment, where if your ratio is greater than 1, it's worth investing in. Now, typically, the health sector has not liked to work in the area of cost-benefit analysis. Why? Because it means that we have to assign a dollar value to a life saved or to an illness averted, and that's not always easy. One of the advantages, though, for thinking about cost-benefit analysis for nutrition-sensitive investments is that it's better able to capture the short-term benefits, the long-term benefits, and other monetary benefits that wouldn't typically be captured in cost-effectiveness analysis. And then we have two kind of cost analyses, or cost minimization, or cost efficiencies, and they're partial economic evaluations that focus on the cost of the intervention, or the cost of scaling up, or the cost per outcome achieved. These are critically important for assessing financial and economic affordability, right? And so all of these economic evaluations help us to strengthen decision-making and priority setting. So where do we typically use these kinds of data for in global health, and where have they been particularly important? For health technology assessment and innovations, and usually in the field of global health, this could be for a vaccine, for a diagnostic, this could be micronutrient assessments for a drug, and so this helps us to introduce a new technology and understand whether it's cost effective and to try to get a sense of the cost of introducing it. We use economic evaluation for intervention prioritization, for coming up with a package of interventions. More and more countries are moving toward designing a package of interventions for universal health coverage, and using economic evaluation to help determine what's in and out of that package is essential. It may also be used in the development of treatment guidelines and other policies that may end up causing countries, right, to introduce interventions or technologies that have economic opportunity costs. And so you need to evaluate what does a new guideline or policy imply for a Ministry of Health or Ministry of Agriculture's investments. And then finally, we use benefit cost analysis for program development or scaling up. You can see that the Copenhagen Consensus was critically important. A benefit cost analysis of wheat flour fortification was really important for the Copenhagen Consensus, which looked at benefit cost ratios across a wide range of investments and was critical for raising the importance of investing in micronutrients, malnutrition at a global level. And then again, for specific funding decisions where we have pooled donor funds and the Global Fund for AIDS, TB, Malaria, or Gavi, where they need to know how to invest their money. Now, one of the challenges, and I think that I don't have to go over this too much since Anna, thank you for talking about some of the challenges of measuring costs and benefits of nutrition-sensitive agriculture investments. It's not as straightforward as what we can do in the field of global health. Currently, we have limited information on costs and impacts for nutrition-sensitive interventions. Much of it is modeled. There's just limited empirical evidence and limited published information when we want to know about the cost of agriculture nutrition investments. And so that which is out there is hampered by a lack of standardized methods and a singular outcome measure that can capture all of those direct and indirect benefits that Anna was talking about at the beginning of this call. It's not just reduction of micronutrients or wasting or stunting, but it's also the increased food security and the benefits of women's and gender empowerment and impacts on education and productivity over time, right? So it's really hard to find that singular outcome measure that captures all the benefits of multi-sectoral or nutrition-sensitive investments. And again, cost effectiveness just isn't well suited to that, right? Because it really cannot put a monetary value on some of those outcomes that are so critical. And we'll look at what some of those are in a moment. And then we're kind of hampered because in health and agricultural interventions, in fact, we're working across sectors that typically measure their impacts and costs differently. In the health sector, we can look at cost by intervention, facility, community-based, or individual, and get some sort of cost per beneficiary. But in the agriculture sector, they typically are looking at the cost of investing in crop production, increasing yields, or expanding acreage of something, or by household, a measure of net income. So that's a difference in just how we perceive evaluation in both those fields. And finally, there's many spillover effects that are actually hard to measure when you invest in agriculture or nutrition-sensitive investments. For the community, for all members of the household, it does get hard to measure these spillover effects. So what do we know about economic evidence to date? And I want to recognize that this work that I'm about to share with you was done initially by Results for Development on some work that they published for the African Development Bank, and then we've added to our knowledge base. So what we're looking at is evidence of impact we looked at the evidence for interventions that have been recommended by the Scaling Up Nutrition Compendium of Action. And they tend to look at, they think about investments or interventions in the health sector or our nutrition-specific interventions in health, also through agriculture, WASH, and livelihoods. And today we're going to just focus on what we know in the health area and nutrition-specific, and then agriculture. And so what we, when you see the slides, have a look at if there's a black dollar sign if the information has cost data, intervention has cost data, whether we know something on evidence of cost effectiveness, or whether there's anything on economic outcomes, increased education, wages, productivity. So here's our, we are looking at nutrition interventions and health over the life course, and you can see what do we know about pregnant women, neonates, infants and children, and adolescents. And you can see that studies that we've got a legend here where we have studies where we have evidence on primary health outcomes, evidence in kind of a yellow, in intermediate, and gray where we really don't have strong evidence. And we know a lot in the field of health in terms of both what works and to some degree cost and cost effectiveness data. But when we shift to interventions in agriculture that impact nutrition, and this now looks at from sort of a nutrition sensitive value chain, from production to processing and storage, retail and labeling, and purchasing and consumption, our evidence on what works is not as strong, and we don't have as much information on cost effectiveness, the little green symbol, as we would like, and even not as much information on cost of critical interventions. So what we're trying to do, excuse me for one moment. So what are we trying to do? We're trying to, the SEAMS project is building on, this is the ANH Academy technical brief that Abel and Anna mentioned, and it's available online. And we developed this and presented it at last year's ANH Academy. And what we started to do was think about how do we address the lack of standardization for multi-sectoral and nutrition-sensitive investments, and how do we start to create a common approach and a common language to encourage the generation of empirical evidence on costs and benefits, so that 5 years down the road we will have the information we need to help inform program design, to help inform priority setting and resource allocation. And so I'm going to go over just the basic steps and tell you a little bit about what our project is doing, and then we'll open it up for questions. So SEAMS Nutrition, the project, which is a collaboration between the University of Washington, IFPRI, Results for Development, and Helen Keller International in Nepal, and ILRI, the International Livestock Research Institute in Kenya, and working also closely with GAIN. We are developing and applying a common approach for integrating cost data collection into ongoing impact evaluations for nutrition-sensitive or multi-sectoral strategies. So what is it that we are proposing? One, we've developed a typology of interventions. Often people think, oh, nutrition sensitive, there can be so many different ways to organize and different intervention components, and perhaps they're too different to compare to one another. So one is to try to simplify it by developing a basic typology where people can start to see how their interventions fit into one of these typologies of interventions. Then we build on the MAPA impact pathways and identify program activities, inputs, and costs, and I'll go in greater detail. We develop a standardized cost data collection tools and cost data alongside impact evaluation, and that's an important, for economic evaluation, for full economic evaluations, we must be able to work with either modeled or empirical measures of impact. And then finally, we compare program costs and benefits to look at the relevant question or decision that needs to be addressed and the relevant sector. So let's look at the generic typology for interventions. And what we're building on is a typology that has been developed for EFAD that looks at three or four main typologies. One is to increase the supply of nutrient-rich foods. And you can see that in this diagram that we have increasing access to inputs, increasing agricultural productivity by increasing access to technology, extension capacity, storage and processing, distribution, and transport. and trade and marketing, right? Then there's a set of interventions that are aimed at improving the demand or increasing the demand of nutrient-rich foods. And those are often behavior change, communication, also demonstrations on how to improve the preparation and of nutrient-rich foods. And then we have enabling environment, which are whatever kinds of interventions that are building capacity or addressing, perhaps it could be water sanitation and hygiene as part of an enabling environment, or something to improve along the nutrition sensitive value chain at a higher level than the household level. And then all along it are interventions perhaps to improve women's empowerment. So if we think that if we even just simplify it and think of 3 types of interventions: increased supply, increase demand, and enhance the enabling environment, then we can start to think of mapping impact pathways for whatever program activities are part of your multi-sectoral strategy, right? And so if you think of a program impact pathway, which is on the screen now, you've got activities that are very much around increasing demand. You've got at the very bottom on the left-hand side of the graph, interventions to enhance supply. This might be extension or providing seeds for aquaculture, poultry production, or home gardens. And then you've got interventions that, again, are enhancing the value chain or just a broader enabling environment for that interface between supply and demand. And then again, this is really just very standard program impact pathway where you start to look at the changes in outcomes along the way, changes in behavior, changes in diet, and ultimately changes in health and nutrition status, or changes in income and economic status. So for any intervention, you should be able to articulate this pathway. And once you do, let's say that our activities are along the nutrition sensitive value chain, and so our activities are related to extension, production, storage, and processing. At that point, we can start to think about what are the inputs that are needed and what kinds of costs are needed. The cost to the provider, direct costs of the intervention, or institutional and fixed costs of sort of shared program management and integration and coordination, and then what are the costs to your beneficiary for participating in a particular intervention. And you can look at those direct and organizational costs and opportunity costs to the beneficiary for each set of activities and inputs. And then, of course, here's where the challenge comes, what Anna was talking about. We know that nutrition-sensitive interventions or multi-sectoral interventions produce a range of outputs and outcomes along that program impact pathway. Most of us are familiar with these. Many of them are measurable and can be included in cost-effectiveness analysis or cost-utility analysis, such as changes in anemia and hemoglobin, or changes in illness averted or death averted, or stunting. These can be converted into death averted, and these can be monetized. But how do you add these up to some of the other types of benefits that we're observing? Increased food security, increased women's empowerment. How do you combine it with changes in dietary diversity? How do you get one metric that can capture this full range of benefits that we expect to see from a well-designed nutrition-sensitive intervention? So that's the crux of the SEAMS project. We're trying to address that, and we're trying. Our solution is to try to think about first moving toward a standard set of outputs and outcomes, and providing recommendations how you can look at costs for particular outcomes achieved. So we have our activities, our inputs, we have our costs for these different groups of activities, and we expect to see changes along that program impact pathway. But we also expect to see an integrated cost, a cost per beneficiary reached. And so our project is trying to generate a toward a standard unit cost typology, so that that when we start to generate information on a range of multi-sectoral interventions, whether they are livestock production linked with nutrition, behavior change, or whether it's aquaculture, or whether it's market-based solutions, we can break any intervention down into its typology, into the intervention components. We can ask people to give information on the intervention details, and then we can break it down. If you look at the category here called activities and technology, you start to see that most interventions comprise many of the similar activities: the development of materials, training of trainers, of extension, home visits. And so starting to move toward standard units of direct cost, standard units of shared cost, and ultimately, when you generate a cost per beneficiary reached, you will have a good idea of what's in that cost. And that makes it more, that if we can start to promote a standard measurement and reporting of costs, we can start to compare these across studies. So to give you an example of the benefit of standardized, for instance, cost activities, here's another way to think about it. If in fact we think that most interventions have these kinds of activities: materials development, training, distribution of inputs, integration and distribution. In this case, there were school meals, that may be home visits in a particular intervention, and then monitoring and evaluation and planning. One can start to generate information on cost and cost profiles that start to be comparable across studies. So again, a big part of what the SEAMS Nutrition is trying to move towards standardization of cost categories and ways to collect and measure and report out. Finally, the last step of the SEAMS Nutrition approach, of course, is around the measurement of cost and health, agriculture, and economic benefits. To start to move that forward, we're doing many things. We'll be demonstrating, if you recall, the set of different kinds of economic evaluations: cost efficiency, cost effectiveness, cost utility, benefit cost analysis. Our project will generate all of those to find out where are they consistent, where are they lacking, where can we advance the field to ensure that we're not shortchanging nutrition-sensitive investments. And then finally, we're applying this approach in these 6 settings. So at the end of 3 years, we actually will have standard cost and economic evaluations for a range of projects, from a scaled up multi-sectoral nutrition strategy in Nepal to several randomized controlled trials at a smaller scale on integrated poultry value chain, integrated agriculture, health, nutrition. And then we actually are really fortunate to have 2 market-based interventions where we'll be generating information on costs and benefits as well. We don't have time to look at how this approach is applied, but I would encourage you, if you have not already seen an excellent IFPRI policy seminar on the Malawi case study for early childhood development. The link is in these slides. We have applied the SEAMS Nutrition approach, and I encourage you, the seminar is super interesting, and you can see how this works. So let me thank all my SEAMS Nutrition partners. Again, we couldn't do this work without our colleagues at IFPRI, Results for Development, Helen Keller, Ilri Gain, and our own team here at University of Washington. Thank you.
Thank you very much, Carol. A lot for us to think about, and some tools to use to be able to think about this in each of our own programs that we may be involved with. There are already some questions, and to the participants who have submitted questions, I've taken note of those, and we'll discuss them in the Q&A. First, I will turn it over to Professor Jim Levinson to share some of his thoughts on the topic.
Thanks, Anna, and thanks so much, Carol, for that very illuminating presentation, and greeting, friends. I'm especially pleased to learn, Carol, that you and the other SEAMS folks have been actively involved in the Suahara project in Nepal, one on which I've also worked, and it's especially close to my heart. I hope, Carol, that the Suahara project and others will not only monitor and evaluate effectiveness as you've discussed, but also will monitor sustainability. We'll set some sustainability objectives, monitor it as you monitor project implementation, and then a couple years after the termination of the project, evaluate the sustainability using the initial sustainability objectives. Let me say a few words about your work on multi-sectoral nutrition and then focus on agriculture. One of our important discoveries about multi-sectoral nutrition, which needs to be taken into account in cost-effectiveness analysis, is that when a country identifies its most vulnerable areas, and then, rather than providing inputs from the various sectors arbitrarily, rather focuses them all, implements them all intentionally in each of the villages in these vulnerable areas. And when that happens, the results become synergistic. 2 + 2 = 5. So we need to look for that in evaluating such programs. In terms of agriculture, my hope is that Carol's presentation will inspire our Ag2Nut community to get to work on actually evaluating nutrition-sensitive agriculture projects. In my mind, our very highest priority at present. And my only suggestion, Carol, for future presentations, and let's hope there will be lots more of them, is that you give even more attention to food security as an outcome or impact indicator, often a more meaningful measure in evaluating nutrition-sensitive agriculture, in evaluating nutrition-sensitive agriculture projects than nutritional status. To get an impact on nutritional status, as we recall from the UNICEF framework and its various iterations, economic improvements may not be sufficient to affect nutritional status indicators if, for example, caring practices are deleterious, or there's an absence of healthcare facilities, or problems of poor water, hygiene, and sanitation. And there are available some particularly useful measures now of food security. But here's the big problem as I see it with the kind of evaluations that we'd like to see in nutrition-sensitive agriculture. There is unquestionably a critical mass of agriculturalists in the world who care deeply about the importance of achieving nutritional benefits through agriculture. And I suspect that many of these folks are part of our Ag2Nut network. At the same time, agricultural project planners and managers on the whole, sadly, are not quite that committed. In fact, these managers and planners often face huge and well-documented difficulties in carrying out their tasks, even with their existing orientation. So with this extensive array of problems, these agricultural planners and managers are less than eager to include additional indicators like nutritional and food security into their M&E systems. Anna Herforth and I proposed a possible solution to this dilemma at an FAO-WHO gathering a few years ago, and an article on this will soon be published in Food Security. And our proposal is that while the agricultural managers are carrying out their more traditional analysis, including hopefully the collection of cost data along the lines that Carol suggests, a group of folks like ourselves would simultaneously be collecting the additional baseline and monitoring data we believe to be so essential. Data indicating the extent to which households have been reached by the project, data on household food security levels, information where relevant on market level indicators of food availability and prices, women's empowerment, and where appropriate on nutritional status. Anna and I have suggested that the utilization of Sentinel sites may be a useful means of collecting such data, this involving pre-project baseline data and then data collection at 6-month intervals in a specified number of locations, well distributed. And because we're such cooperative and accommodating people, and because we'd like the project to pay for at least part of our work, we would collect additional data of primary interest to those project managers. Data, for example, on the percentage of the labor force employed, the access, use, and satisfaction of villagers with project services, and also changes in farmer incomes. It would be important also to collect qualitative information on any other beneficial or harmful effects that the project is having on food security or nutrition. And to address the attribution issue, there may be value in larger projects for us also to include in this periodic food security and nutrition data, data from comparable control populations. In the end, these agricultural projects with nutrition-sensitive dimensions would be reviewed jointly by project managers and by Ag2Nut M&E teams, both in terms of the project's production objectives and in terms of its food security and nutrition objectives, while determining whether the projects are environmentally and economically viable for producers and funders, and ensuring that no harm is taking place. Okay, that's plenty for me. Let's move forward.
Thanks very much, Jim, for those remarks. And I think we have a number of questions. For a first set, Carol, I'll turn it over to you to answer, maybe respond to what some of Jim was saying, which I think really points to extending this work, being not limited to just ag nutrition programs, but trying to mainstream this sort of evaluation in regular agriculture projects to understand nutrition health impacts and costs related to benefits that may not regularly be assessed. And jumping off from that, I wanted to bring in a question from Noreen Mucha, which is, do you have a template for the costing? So maybe something that could be applied by other projects and extended and mainstreamed. And then I have a question to add in relation to what Jim brought up about qualitative assessment, which is how big of a role does qualitative assessment play in cost benefit analysis, do you think? So maybe we'll start there, and then we have some other questions lined up.
Great. Thanks for those questions. I guess, Jim, I guess what I would say to some of Jim's comments, and maybe I can address I think because you did bring up qualitative assessment as well. So I'll lump those together and then answer the question on the template after that. For sure, I guess the first thing I want to say is that economic evaluation is one piece of information in decision making. And we would absolutely expect and recommend that when you cannot quantify a benefit or cost of a particular indicator, that you should qualitatively assess the impact on that. So I think we're all in agreement that qualitative assessment alongside cost data collection impact evaluation is essential. We don't always have the luxury of doing that because of budget constraints for our monitoring and evaluation. And so one of the benefits about doing cost assessments is that it's fundamentally qualitative. You're looking at how are things being implemented, what are the benefits being generated, and you're measuring and valuing where you can, and that's either going to be with a dollar valuation, or if it cannot be incorporated into your overall metrics, then it's essential to talk about that. And so, again, you may know that we've often done operations research alongside economic evaluation, impact evaluation, and of course there's a rising emergence of implementation science, which starts to consider fidelity, feasibility, acceptability, and cost. And all of that, things become more acceptable and more feasible if households benefit along a long range of outcomes. So I do think that's critically important. To the question of how do you get the agriculture sector to start to apply this, I guess I'd have to push back just a little bit. If an agriculture investment does not explicitly have a nutrition or health outcome as one of its primary or secondary goals, it's very hard then to evaluate that investment for that particular outcome. So again, we are using a fairly standard, a very standard approach. We're not changing economic evaluation. Rather, we're trying to develop standardization and methods along already existing economic evaluation. So an agriculture investment would really initially, Jim, I think, have to have health or nutrition outcomes, at least as a secondary goal. And then one could start to try to apply this approach. Another thing that's essential is if you want to do a full economic evaluation, then in fact, whether it's in the ag sector or working across sectors, we have to actually have program impact assessments. They don't have to be RCTs, but they have to be generating evidence on the effectiveness of the scaled up or maybe a pilot demonstration. So let me just stop there. I'd like to answer the third question, but see if that answers Jim's questions, and ask if you could give me control of the shared. I'd like to share something on my screen to answer. Yeah, thank you. Okay, Jim, Jim and Anna, did that answer your questions?
Yes, thanks so much. Thanks so much, Carol. I'm aware that agriculture projects sometimes get some pressure from somewhere else in the bank or the UN system to pay some attention to nutrition. So an objective may get in there without it receiving a lot of attention in implementation. And we want to look at those projects as well as those that are much more actively meeting some nutrition objectives.
Great. Couldn't agree with you more. So to answer the third question, or the second question on is there a template available, what we're sharing on the screen is actually to date the steps in doing a costing alongside and evaluation. This is focused predominantly initially on cost data collection. Again, what I said is in order to do a full economic evaluation, you would have to have information on impact or effectiveness of the particular program or intervention. But here is what we have available to support integrating costing on an impact evaluation. We have an economic evaluation matrix that helps you to think about what you are measuring. We have a draft protocol, which is critically important for laying out what you're going to do and also getting research ethics approval. We have what we call a project activity tracking sheet, which helps you to identify what you should cost. And yes, we have a series of data collection forms and guides. And in fact, we're developing an Excel template for analysis. So in answer to your question, yes, we have templates available. We're happy to start sharing them with the recognition that they are drafts at this time. So if you use them, we'd like you to provide feedback to us. Over.
Thanks, Carol. Perfect. So I will read the next set of questions, and then I see two hands up from Anne-Marie Mayer and Professor KB Narayana. So we'll go to those after this set of questions that was written in. So one question from Yurika Ueda is, how do we measure outcomes of women's empowerment attributed to the intervention? Second question from Alessandra Furtado is, how are you incorporating the cash and in-kind costs of beneficiaries, for example, people's time attending training or other opportunity costs? And Also, how do you propose to monetize changes in food security or diet diversity or WASH? And are there other methodologies being used other than dailies or qualies? And then I wanted to add a related question, which is that you in your presentation mentioned cost to providers and also cost to beneficiaries. And kind of building on what Jim was saying about making sure to evaluate sustainability, as far as the direct and opportunity costs to the beneficiaries, wouldn't the best evidence of cost effectiveness or cost benefit be if they continue to participate and do what was promoted in the intervention past the program period? Over.
Okay, sorry, you could hear me writing down the questions. Sorry if I don't answer them completely. Just bring me, make sure that I do, Anna, because I was sort of writing quickly, so I'm not seeing the questions, so it's a little hard to answer. So, first one, how do you incorporate the cost to the, in kind and opportunity cost of time? So, in fact, you may not, in the previous slide, which I've taken down now, sorry, I guess we could go back to it. Maybe we should do that. That would be useful if you can let me share the screen again. But in fact, what we do is we are providing guidance on how you collect information on beneficiary out-of-pocket costs, their opportunity costs of their time and their land. And so and not only that, but often interventions are funded externally and implemented by our large international NGOs. They often work with local community-based organizations, but we know several things. We know that they engage community health workers or community agricultural extension workers. We know that they use volunteer time. We also know that governments often are participating in these interventions, and so there's a series of shared costs that may not be explicitly covered by a particular intervention, but rather they're being asked to attend meetings, and that they may get per diems and travel allowances, but their time is not covered by these projects. So in fact, we provide guidance on how to collect information on time allocation by anyone that contributes their time, whether it's government, whether it's a community health worker, whether it's a beneficiary. And we do this by providing guidance on sampling, for focus group discussions and key informant interviews. And so we have a time allocation form that actually will help you to capture that, and we're developing actual templates on how to cost it. So in answer to your question, if you can collect information on time use, then in fact we propose how do you value that time. Typically in rural areas, if they're agricultural communities, we'll find out what that average daily wage rate is, and we'll value community health worker times or ag extension volunteer time by the number of hours, an average number of hours that they participate monthly or annually for a given intervention, times that sort of locally relevant wage rate. So we have thought about those methods, and we do provide guidance on that. And there was the question on monetizing food security, WASH, and dietary diversity. One can capture some of the costs of achieving food security, obviously, but one would want to, but you can't really monetize an index like that, right? So we could capture the increased value of consumption, perhaps. We can capture if there's increased income from an investment in improved agricultural productivity, but that sort of well-being, of food security or women empowerment, really these are what we call intangible benefits, where we can certainly capture the cost and averted cost of being food secure or of women being engaged, but we haven't really come up with a way to monetize those yet. In WASH, what's typically done, our benefit cost analyses are often done to look at the benefits of WASH. So the person that asked that question, those are the challenges that we're dealing with. So what we're doing is we are generating information on what is the cost to affect a change in that index or a change in dietary diversity. And so we can understand the cost of achieving those critical investments. Somebody asked about how do you measure women's empowerment? How do we measure outcomes of women's empowerment? That is a little bit that's not, our project doesn't give guidance on that. People are using the WIA index. I think there's an intensive one and there's a sort of WIA light. You can, again, measure progress in women's empowerment, and you could probably look at the cost of changing women's empowerment. And one could perhaps look at the cost of the intervention to get there. But again, capturing, valuing the benefit, it's an intangible and it's a bit challenging. Finally, you asked about evaluating sustainability, and you would measure that as the beneficiary to continue participating past the investment. And again, that's again beyond what we can do, right? Wouldn't it be nice if we could all go back and measure that participation after an intervention? But typically, there really isn't information on that. Donors don't typically fund that kind of a study. And so while I agree with you, that's the ultimate aim of an investment, sustainability, the best we can do is get a sense of what is the impact of this investment on, for instance, beneficiary opportunity costs. And if we think it's reasonable, we can say that this seems to be affordable, it seems to be beneficial, the benefits outweigh the cost to the individual. The best we can do at the household level is probably some sort of assessment to what it looks like, but without actual empirical information on whether they continue to participate or not. That's a little bit beyond the scope of what we can include in our analysis. Over.
Thanks, Carol. Masterful job of remembering all the components of those questions. I'm gonna, well, first of all, it is an hour past, but we're, Abel is kindly able to keep the webinar open for another 10 minutes or so. So we have some time to answer additional questions. So first, Anne-Marie Mayer has had a hand raised, and if you're able to unmute yourself and go ahead and ask your question, Anne-Marie.
Here I am. Yes, thank you very much indeed for that talk. I enjoyed it very much. And as I was listening, there were a couple of things that sprung to my mind. The first one was really about the participatory research and evaluations. And it seems to me, listening, you know, you're doing a lot of thinking and drawing out theories of change, trying to work out what all the different benefits would be, and sitting down and discussing with the communities themselves what are their main points that are of value to them, and working backwards from what they say. And I wonder whether that's the sort of thing you do in your qualitative assessments. I'm thinking of an example when I worked with a permaculture project in Nepal, and I asked women, how has your time been saved by this project? And they reeled off about 10 different things that I wouldn't have thought of myself. So starting with what did they find beneficial and working backwards seemed quite a good way. And the other thing really was about the environment and, you know, the issues of our time, climate change, loss of biodiversity. You know, I think we've got to be getting these into our evaluations, and then we get a lot of synergies. You know, things that are good for the environment are also good for nutrition. So trying to really work with some of those issues, and it feels to me that they need to be in there when we do these types of evaluations. So anyway, those were my thoughts.
Great. Do you want me to answer that quickly, Anna?
Sure.
Yeah, let's do that one, and then we'll do the two other hands that are raised. Yeah.
Thanks, Anne-Marie. So again, what the approach that we're recommending is to integrate economic evaluation into ongoing process and impact evaluations. It's really critically to kind of note that this is a very, this is not a global economic evaluation. These are strengthening economic evaluations of programs or interventions or pilots or randomized controlled trials that are being implemented at the country level. And so to that, yes, I do, Anne-Marie, we do, there is participatory research and evaluation. It may not, in as much as focus group discussions become participatory, I do believe that does help inform what are the perceived benefits. And I guess I would say that, again, it's critically important that economic evaluation complements everything else an evaluation is doing, including a participatory research, looking at how does your quantitative analysis or qualitative analysis map to what beneficiaries themselves say they value. And interestingly, Anne-Marie, we are considering doing a willingness to pay study of what households value for child nutrition. And in doing that, we will in fact be engaging with women to find out what they value. And we can see if that jives with what our community has said. The second issue around climate change is, again, that's if there's an intervention or a program that explicitly has a component to address that, we can certainly try to include it. It is a little bit beyond the scope of what we're doing. We're not environmentalist economists, and it adds a whole nother layer. I don't disagree with you, but again, recognizing that this is the evaluation of nutrition-sensitive approaches at the country level. If there is something to mitigate climate or that is sustainable, we'll capture it. But if it's not in the program or intervention design at this point, our group is not addressing it. But I agree with you; it's critically important. And I think there are other groups that are starting to look at that issue.
Okay, thank you.
Thanks very much. And we have two other hands raised. First, I would like to invite Professor KB Narayana to make a question, and Professor Narayana, would you like to try unmuting again? There seemed to be a technical difficulty. And there seem to be technical difficulties with the sound. So B, would you like to go ahead with your question?
Oh, thank you. Yeah, I guess I just want to push back a little on walking away from the question that Jim raised about sustainability. Your response was, well, we'd love to do it, but it's not typically done. Donors don't really like to go back. All of that is 100% true, and unfortunately, unfortunately that's true. But I think it's certainly possible, and I think we, rather than say, oh, that's a really good idea, but we can't do it, I'd rather hear, let's push back on that and encourage people to recognize that making a change is good, but making a long-lasting change is much better. And so I would just modify our thinking a little bit instead of, I guess, throwing up our hands.
Thanks, B. I guess what I should say is we have ways of evaluating sustainability. Just I think it was Anna that raised that, and she thought one of the measures should be looking at whether individuals continue to participate in the intervention past that sort of implementation phase that's externally funded. In terms of assessing sustainability, what we're doing is we are measuring, so we're working in a few RCTs, and then we're also working at a scaled-up program in Nepal. And our plan is to model, what is the financial impact to the government of sustaining the investment, right? So from a government, the idea of this is that we are developing strategies that we hope the government will pick up and invest in over time. And so obviously that we can model out, and we can say, this is what it would cost to the government, and this is what it is in terms of a share of what agriculture or health are currently funding. And we can start to explore the feasibility and affordability of these interventions. And if one is measuring sustainability in terms of what we see on the ground and the persistent behavior, sort of improved and sustained changes in knowledge and practices and investment in production diversity and all that, again, we can certainly model it out, and I would certainly, obviously we can do that. It's just one ought to recognize that the best we can do is model and to sort of help look at standard sustainability indicators. So it's not that we aren't doing it. It's just, it's beyond our ability to measure whether participants keep doing things at this point. But, I agree with you.
You
if people would fund
absolutely,
it.
you can't do it without going back. I mean, that you can't,
right.
You can predict, the likelihood. You can say, did it conform to, predictors of sustainability? You can't validate it without going back. And I think it's one of those things where the community is a little too willing to say, yeah, you have to go back. It's sort of like, yeah, you have to measure 24-hour dietary recall. That's too hard. That's too hard. That's too expensive. And I'm just saying, I'd like all of us to just say, when we're doing evaluations, that opportunities to take a look at sustainability and develop some kind of predictive tool for it is, I'll reference the work we did, I and Tufts did for Fanta on sustainability. It's not impossible. It just, you have to fund it explicitly.
Yeah.
So I think we're in violent agreement, except for
great
how hard you want to push back.
Let me just add, B and Carol, let me just add that not only do we want to go back and look at, are these practices still in place, but oftentimes we want to see, after termination of the project per se, if the government or others have picked up the intervention.
Mm-hmm. Absolutely.
Right. Yep, agree with both of you.
Fantastic. Well, I think this is a good note to end on, and sort of the sustainability of these approaches, and how to look at costs and benefits both in the short term and thinking bigger in the longer term, and maybe shifting our donor and project culture towards that. I know that there were a few questions that weren't asked because of, unfortunately, the technical difficulties over the phone. Dr. Narayana did not get to ask the question. There were a couple of others that I can send after the call. Carol, if you have responses to them, we can send them out in the minutes. The final question that is important is, are the slides available after the presentation? And I can answer that one. Yes, they will be. We'll send them out. We'll send the link to the event page with the recording and slides and other materials after we end. So before ending, Jim, do you have any closing words about the topic?
No, nothing to add. I think it's just great that we're doing this, and that we are being so intentional about looking to see what effects these projects are having.
Great, thank you so much for your time and input today. I think I've been learning from you about this topic for well over a decade now, so much appreciated. And Carol, any final thoughts from you on things that came out in the discussion?
No, some great things to think about, and just confirms that I think our community is really thinking along the same lines about how do we monetize or incorporate these hard to include outcomes that we know are so critical, including women's empowerment, food security, WASH, dietary diversity, and sustainability, and climate change even. So all great food for thought. Thank you very much.
Yeah, well, we really appreciate your time and sharing with us the work and thinking you've been doing on this. Also appreciate that you have approached this with, that we don't have the final answers to this question or this topic. This is good food for thought. This is where we are now and some useful tools, and drawing upon work that has been done in different fields of study and evaluation to move us all forward. But there's a lot more that can be developed and practiced. So I think something that's very relevant, especially to the ANH Academy as well, for sharing thoughts and research on this topic within the Academy weeks. And also, of course, there's always the if people are doing work on this and would like to share as time goes on, great stuff to share on the Ag2Nut listserv as well for others to benefit from. So thanks again to Carol, to Jim, and to Abel for facilitating this discussion. And thanks to all the participants for your questions and participation. And we will reach out with the materials of the webinar for you to refer to. Thanks again.
Great. Thank you, Anna. Thank you, everyone, for joining.
Thanks, Carol. Thanks, Jim.
Okay. Bye-bye.